Hello viewers, welcome back to my channel. Today we shall be talking about hyperglycemia. But before that, just a quick reminder, if you haven't yet subscribed to my channel, kindly do so. Leave your queries, leave your comments, and if there is any topic that you'd like us to discuss, kindly let me know. So hyperglycemia is high blood sugar levels above 11 millimoles per liter for a random blood sugar test and above 7 millimoles per liter for a fasting blood sugar test, or a test that is normally done after 8 hours of fasting or after 8 hours of not taking any meal or any drink. So diabetic patients normally experience hyperglycemia if they skip their medications, or if they are suffering from an illness, maybe a cold or a flu, or from an infection, or if they are not exercising enough, or if they are not following the proper diabetic meal plan. Now, for individuals who are not known diabetic patients, you also find that they may experience hyperglycemia if they are suffering from illnesses, for example, the Cushing syndrome or pancreatitis, or they have been under certain medications like the steroids or the diuretics for a long period. So we also have something known as stress hyperglycemia, whereby the sugar levels normally gets elevated temporarily or for a short duration due to stress from an illness. But in most cases, you find that the sugar levels normally stabilize once the illness or the cause of the hyperglycemia has been addressed or has been resolved. So when you look at the signs and the symptoms of hyperglycemia, we have polyuria or excessive passage of urine. There is also excessive hunger. We have excessive dust, also known as polydipsia. And we may also have weight loss. And we also find that this individual may be experiencing delayed healing of wounds or injuries or bruises. And at times you also find that this individual may have skin infections, for example, boils. So if hyperglycemia is not addressed, or if this individual doesn't receive the necessary treatment, they may experience certain complications. One, when you look at the short-term complications, one of them is diabetic coma, which is a life-threatening condition. And we also have diabetic ketoacidosis, which is common in type 1 diabetic patients. And this is whereby you find that when the body doesn't have enough insulin, we know that insulin helps in the absorption of glucose. So when there isn't enough insulin in the bloodstream, that means there isn't enough, the body is not having enough energy. So what happens is that the body results in breakdown of fats for energy. And the end product of this process is something known as ketones. So we find that this individual may experience diabetic ketoacidosis, which is also a life-threatening complication of hyperglycemia. Now, for the long-term complication, we have macrovascular complications. These are complications which affect the large blood vessels. And one of them is cerebrovascular accidents. We have cardiac failure. We have myocardial infarction. And we may also have stable angina. Now, for the microvascular complications, or the complications which normally affect the small blood vessels, we have diabetic retinopathy, whereby there is damage to the retina, and this may progressively lead to blindness. There is also peripheral neuropathy, and we also have diabetic nephropathy, whereby there is damage to the kidneys, which may lead to renal failure. So if you are a diabetic patient, it's very important to always have your sugar levels tested. Ensure that you take your medications even if you're feeling okay, even if you've tested your sugar levels and they are within the normal range. Always take your medications. And if your sugar levels are going below the normal ranges, something we refer to as hypoglycemia, visit your doctor so that you can adjust on the medications. Don't just stop taking the medications, as it may lead to the complications that we talked about. So ensure that you follow the right or the proper diabetic meal plan, exercise regularly, follow a healthy lifestyle, avoid excessive alcohol consumption, avoid smoking, and ensure that you follow your doctor's instructions. Now, if you're not diabetic and you experience the signs, either of the signs or the symptoms, kindly go for a checkup, as this may be an indicator of diabetes, or you may be suffering from a different illness, and it's until you're checked, it's until you're tested that you know what you're ailing from. So don't just stay at home, go to the hospital, have yourself checked, and follow what your doctor will advise you in case you are diabetic. So thanks a lot for watching my video. I hope you've enjoyed. See you in the next.